the patients can develop a relationship with you essentially, and not in the sense of, you know, platonic, but things that are, you know, they really like you. Like sometimes you're the only person that they talk to all the time. And you mentioned this in your webinar as well as, and it's this thought experiment between clinical judgment and patient satisfaction. And so I see this with my home patients too, that sometimes patients want to just be seen because they need someone to talk to. And so when do you make the discernible difference between somebody who needs care versus somebody who really needs to kind of like, all right, listen, like we need to, you know, find the motivation in you and, you know, use some of these external things that you want to get back to so you can do it on your own, because you want them, ultimately you want them to do it on their own because that's what you were there for. But sometimes it's not always the case. So I guess, how do you combat that?
Yeah, I mean, it's really hard for me to give an answer like, you know, one size fit all answer, because I do have that issue, like, just like you. I mean, I find that a lot of patients, they think that therapy is like unlimited. So, and they feel like, oh, I could just go back to my doctor, he'll give me a prescription, I'll get more therapy. And then I have to explain to the patient that it's really, the goal is like what you just said, which is to get them to do it on their own. And we're not really there to maintain their level unless you're under maintenance therapy, which is a whole different class in Medicare. But other than that, I mean, it's really difficult. I mean, it's an ethical dilemma also, because if you're not really providing them with the skill and it's more just personal connections, so then you have to ultimately make the hard choice, and you have to tell them and explain to them that this is the way the system works, and that also you want to say, like, I wish I could stay. I always say it to my patients, you know, I wish I could stay forever. So you want to show them that you like spending time with them. You know, I wish I could just give you therapy for the rest of your life, but unfortunately the system doesn't work that way. So you don't want to, I think that's the best way to approach it. Don't make it like a personal, I don't want to see you anymore. Make them feel like you really do want to see them, but the system is set up in a way whereby they really have to learn to do it themselves.
Yeah. And one way I've been trying to do that as well is by getting them involved as much as possible with their treatment. And what I mean by that is asking them questions like, how have you feel like you've made progress? Where do you feel like you're at? And so when they start in some patients, I've seen that once they start realizing, oh, I think I'm better than I thought I was. And, you know, I made more progress than I think I have, you know, it's much easier to have that conversation. Are there other tools that you've found success with, perhaps, to be like, cause I've had the same talk where it's like, listen, I wish I could see it forever, but honestly, like, we need to, you know, you need to be independent. So are there other tools or maybe ways to get patients to understand what we're trying to do here?
Well, great. I mean, something else that you could do is to try to talk to the caregiver or the spouse also. I mean, you want to get them on board with the mission. So you really have to utilize your relationship, not just with the patient, but with their caregiver. And you have to get the caregiver on the same page as you early on, so that when you're ready to discharge the patient, you can use the caregiver, you and them together can kind of tag team and convince the patient that it's time to move on. So I think that's the other tool that I would use, which is really connecting with the caregiver and making sure that you're listening to them and sharing your plan of care early on, and talk about it early on. You know, this is normal, and say in terms of how many weeks I'm going to see you, and tell them what your plan is, that my plan is that I'm not going to see you forever, early on. That way they know that it's not never ending. So you really have to set that as a precedent early on.